And I'm just waiting for, oh, great, it's on now. Hi, everyone. This is Kevin from Center of Balance. We are acupuncturists and Chinese herbalists based in Dinsdale, Hamilton. And we also have a center in Auckland, Remuera area. So if you know anybody who is suffering from some health issues or have any pains or aches in the body, please don't hesitate to contact us. We can definitely help them. So I'm doing a live topic today talking about shoulder pain. Okay, so I'm going to analyze shoulder pain from a Western medicine's perspective first, and then we'll be talking about shoulder pain from the Chinese medicine's perspective. So let's start by talking about what is shoulder pain. So shoulder pain, we have to look at shoulder joint first. So the shoulder joint is the most mobile joint in the body. The humerus, which is the long bone, and the clavicle, which is the collarbone, and the scapula at the back, the triangle-shaped bone at the back. Together, they form a ball and socket joint covered by a layer of cartilage. Due to its high mobile nature, the shoulder joint is also prone to becoming injured through the manual labor, playing sport, and repetitive movements. When the shoulder is injured, it can hinder your ability to perform a range of motions in your arm, and it can cause a great deal of pain and discomfort. So diseases that are related to the cervical spine, the liver, the heart, and gallbladder can also often trigger shoulder pain as well. So elderly people aged over 60 are more likely to suffer from shoulder pain due to the degeneration of soft tissue surrounding the shoulder. So what are some of the symptoms of shoulder pain? So symptoms of shoulder pain will vary depending on the causes. You may experience a dull ache that comes on gradually over time, or a sharp or burning pain that is acute, means comes on quickly. Other associated symptoms are changing in your range of movement in your shoulder or pain triggered by movement in your shoulder, inflammation, redness, swelling, and heat around the shoulder joint, movement in the shoulder joint with popping, clicking, or grinding sounds, weakness in the shoulder, pain in your arm, neck, or back. So these are all the associated symptoms that might accompany the pain or discomfort in your shoulder joint. Let's have a look. So, minor shoulder pains caused by sports or trauma can heal on their own or recover with home treatments. However, severe cases that involve bone fracture or torn ligaments or are caused by liver, heart, or gallbladder conditions may require professional medical interventions. A thorough examination of the location of the pain, how the pain started, and the specific symptoms associated with your pain can help form an accurate diagnosis. Timely and proper treatment may reduce the time needed for recovery and prevent the reoccurrences of shoulder pain in the future. So let's have a look at shoulder pain through TCM's perspective, through the lens of traditional Chinese medicine. So to understand shoulder pain, we must first have a good understanding of what meridian travels through the shoulder area. So there are altogether 6 meridians on our arm that travels through the shoulder region. So if you look on the inner side of the arm, you have the lung, which is the lung. Okay, this arm is probably better. The lung meridian, the large intestine, the lung meridian, the pericardium meridian, the heart meridian. So these are the three meridians, the lung, pericardium, and heart, that travels upwards on the inner side of your arm. And actually they go into the shoulder. See, the lung meridian travels up and ends in the lung area, so that actually covers the shoulder. The pericardium, again, it travels on the sort of medial side of the arm up here, and that is this part of the shoulder. And the small intestine travels on the inner side of the arm, and oh gosh, oopsie, I just broke the model. Okay, needs to fix it later on. Okay, the heart meridian travels to, again, under in the armpit area and into the heart region. Okay, and on the outer side, on the yang side, what we say in Chinese medicine, you have the large intestine meridian, travels all the way up the neck to the head. The sanjiao, the pericardium. No, sorry, the sanjiao meridian, the triple woman meridian, that travels up the arm and also into the neck, which is also goes through the shoulder area, and the small intestine, which goes around the elbow area and up the back. And also, again, that is all covering the shoulder area. So this six meridians, the 3 yin and 3 yang meridians, travels through the shoulder. Okay, so if there's obstruction in any one of these meridians, will result in pain and discomfort. So causes of shoulder pain can be external or internal. Okay, the external causes including weather and the environment, repetitive strain, and traumatic injuries. So weather and environment. So when the body is exposed to cold and dampness in the environment, the invasion of cold in the shoulder region can lead to stagnation of qi, which is the energy flow, becomes blocked, causing pain and stiffness in the joint and surrounding tissue. Repetitive strain. This is caused by excessive use of the shoulder joint by repeating a particular movement. This type of pain is commonly seen in sports or through repetitive work. Over time, excessive use of the shoulder joint will result in qi stagnation and blood stasis in the local area. Number 3, traumatic injuries. So minor traumatic injuries can result in qi stagnation, whereas severe traumatic injuries can cause qi stagnation as well as blood stasis. Injuries that have not been treated properly can linger on in the body and give opportunities for cold to invade the body, which further exacerbates the symptom. Then you have the internal causes. So shoulder pain may be a manifestation of internal organ issues, such as damp heat in the small intestine or gallbladder channel. Both channels travels through the shoulder region as well, or problems in the large intestine channel. So aching and dull pain in the shoulder region is usually caused by cold invasion or qi stagnation, whereas blood stasis usually causes sharp or stabbing pain. So that's roughly the information in general. It's a general information on shoulder pain from a traditional Chinese medicine's perspective. So what I want to do now is I want to give you some pointers on how you can alleviate your shoulder pain at home by yourself. If you know the points, then it can work really well. Okay, so I'm going to teach you a technique that we call imaging. It's an imaging technique. So imagine that your arm, okay, your arm, so this is the shoulder. Yeah, you don't have to imagine that, sorry. This is the shoulder, this is the elbow, this is the wrist, okay? Imagine your shoulder is flipped upside down. So this becomes your shoulder. So see, like that. This becomes your shoulder part. So that's the shoulder joint. This becomes the shoulder joint. This is the upper arm. This is the elbow. This is the lower arm. And this is the wrist. Okay. So say, for example, you have arm pain in this region. Okay. In the right shoulder. I'm going to use the image in the left arm. So remember, this is my shoulder, the top part of my shoulder. So, and this is the shoulder joint now. I'm going to use the wrist to treat the right shoulder, the left wrist to treat the right shoulder. How do I do that? Now, firstly, I have to know which part of the shoulder is sore, okay? For example, if it's here, at the front, on the side, or at the back. So say, for example, if my shoulder pain is at the front, in this area, okay? See where this blue line crosses? That is the lung meridian. See, the lung meridian comes up here and goes up here and ends here, the lung meridian. Now, I'm going to go to the lung meridian in my left wrist. Okay? So the lung meridian travels from here, from the thumb, on the side, to here, on the thumb side, and down. Yeah. Now, I want you to get a, you can maybe just use your thumb, okay, to press along this region. See, on the thumb side, see, press along this region, sometimes maybe even up here. There may be some painful spots, okay? If you feel a painful spot here, I want you to give it a good rub. If it's here, I want you to give it a good rub as well for 30 seconds to a minute. It might even run down here along the lung meridian. Give that a good firm press down and then rub for about 30 seconds to a minute. See if that can help you alleviate your shoulder pain. So that's all the tips I will give you for today, and that's to be able to treat the front pain at the front of your shoulder. Okay. So if you have any questions regarding shoulder pain, please don't hesitate to contact us. You can find us online on Google. Just type in Center of Balance, Hamilton, or Center of Balance, Remuera, and you should be able to find us. And please give us a call if you have any questions. And we are looking forward to hearing from you soon. Thank you very much for tuning in. I'll see you next time.